Hi, I'm Sarah Osivnik. I'm going into my senior year at Rittman High School, and I'm in the radiology internship program here at Cleveland Clinic. Extent of left ventricular scar predicts outcomes in ischemic cardiomyopathy patients with significantly reduced systolic function. A delayed hyperenhancement cardiac magnetic resonance study. The background on this study is that patients with ischemic cardiomyopathy and reduced left ventricular ejection fraction have poor survival. Such patients have a high myocardial scar burden as well as a significant remodeling resulting in dilated and spherical left ventricles. Cardiac magnetic resonance is highly accurate in delineation of myocardial scar. The objective is to determine if left ventricular scar extent measured with delayed hyperenhancement cardiac magnetic resonance imaging is more powerful predictor of survival than other markers of remodeling like left ventricular volumes and sphericity. We had a pool of patients, 465 of them, with a greater than 70% stenosis in one or more epicardial coronary arteries. 75% of this pool were men with a median age of 66 years and median left ventricular ejection fraction of 23%. Undergoing Doppler echocardiography and cardiac MRIs were studied. SCAR was defined as greater than 2 standard deviation above viable myocardium. Left ventricular scar volume and percentage was recorded on delayed hyperenhancement cardiac MRIs and subdivided into 7 anterior, 5 inferior, and 5 lateral segments. Left ventricular volumes, ejection fraction, and sphericity indices were calculated with cine MRI images. Mitral regurgitation severity was determined by echocardiogram. Medical charts were reviewed to certain demographic data, medications, revascularization, and device therapy. The primary endpoint was cardiac transplantation and all-cause mortality. This is an example of how we measured the short axis images to get left ventricular volumes and ejection fractions. The measurement off to the right side is the ejection fraction. These images are of the SCAR images, where we would measure the endocardium and epicardium of the heart. The areas that are highlighted in yellow are the SCAR areas. This was measured on a 4-chamber cine view with the D1 plus D2 plus D3 divided by 3L. It made the left ventricular volumes and sphericity and was indexed to the BSA. The demographic chart shows the ages of the total study of the 465. The group 1 has end events as in death or cardiac transplantation, and group 2 has no events as in they're still alive. There's quite a difference between the age in group 1 and group 2, which indicates the scars are worse in group 1. The interventions are like a coronary artery bypass graft, shows that the group 1 didn't have as many or had more interventions even though they passed. The imaging variabilities, the different measurements that we took on the heart were pretty similar, but the p-value was pretty high on most of them, which isn't a great thing. On the multivariate analysis, on the first 4, the p-value is very low, which shows an individual indication of what the individual indication of the scar, how bad the scar is on that particular patient. The red line is patients who have 0 to 17% scarring on their heart, and the black line is when they have more than 45% scarring, which there's quite a difference between the two lines, which means that patients with more scarring died or passed away before, or more than ones with little scarring. Here, the mitral regurgitation, which is how hard the left ventricle pumps, 1 is very good and 4 is very bad. And there's obviously quite a difference between the survival rate of those two also. In conclusion, in patients with ICM and severely reduced left ventricular ejection fraction, a greater extent of myocardial scar, presence of mitral regurgitation are independent and more powerful predictors of all-cause mortality and cardiac transplantation than end systolic volume and sphericity indices delineated by DHE MRI. And I'd like to give a special thanks to Lisa Asamoto, Scott Flam, Zoran Popovic, Deborah Kwan, and all the members of the Office of Civic Education Initiatives.